This is an update from Tallahassee from the Florida Association of Homes and Services for the Aging.
Hello, my name is Carol Berkowitz, and I'm the Senior Director of Regulatory and Legal Affairs at Florida Association of Homes and Services for the Aging. Welcome to FASA's weekly Highlights from the Hill. FASA leads the way. We are featuring this weekly video clip to serve as an educational tool for our FASA members to receive important information on critical 2011 legislative issues. This week, I had the pleasure of meeting with Representative Matt Hudson, a Republican from Naples, Florida. Representative Hudson serves as the chair of the House Healthcare Appropriations Subcommittee, a very important committee for FASA members. We will certainly all want to watch Representative Hudson and his committee during this session. The subcommittee will make very important recommendations related to healthcare services and the budget, including Medicaid reform.
You know, this year my role as chair of healthcare appropriations, our subcommittee, it's a fairly daunting year. We have significant challenges in the budget. As I mentioned in committee yesterday, you know, the question is, are we going to be $3.6 billion short, or are we going to be $4.5, $5 billion short? And as people listen to this, they think, well, wow, that's not so much out of a $66 billion budget. We can probably make that work, except it's not out of a $66 billion budget. That money that we're short is out of our discretionary dollars, our actual general revenue, which is about $36 billion. So now you say, well, $5 billion out of 36, now that's a significant cut. Now we're looking at potentially a 15% cut. And you know, if it's your own business, your own personal finances, thinking about taking a 15% cut out of that is difficult, and that's what we're faced with this year. Well, Medicaid reform is certainly the topic that is driving our session this year. And it's driving our session because it's the number one thing that we spend money on as a state. For every dollar that we spend of yours, 28 cents of that goes to Medicaid. We know that if we don't control and flatline our costs and utilization, we can't do much about enrollment, obviously. We know that in 2 years we'll be at 33 cents on the dollar. And that is completely unsustainable. And that does not factor in the potential of national health reform. And so as we look at this, we know that we've got to come up with a way to control this. And so the Senate has a plan. We have a plan. Personally, a little jaded, of course. I like the House plan better. But I think it makes for a comprehensive approach to bringing things under control. Now, there are certainly critics of the plan. There's critics of both plans. I'm pretty much a firm believer that if you make everybody happy, you probably haven't done anything. But if you irritate everybody a little bit, you've probably done something. And I think that's where we're at. You know, of course, we have a constitutional mandate to balance the budget, and that will really drive the last 3.5 weeks of session as we come down to the wire. I think personally we're going to be somewhere around $4.5 billion short. I don't think it'll be the $5 billion. I don't think it'll be the 3.6 either. So we will have to make some very difficult decisions that will impact people and our communities. At the same token, just like our citizens have to do and live within their means, we certainly have to as well. We cannot spend more than what the people send us, and quite frankly, we shouldn't spend as much as the people send us.
Representative Hudson also serves on other critical House committees. His committee assignments include the Full Appropriations Committee, the Federal Affairs Subcommittee, Health and Human Services Committee, the Health and Human Services Quality Subcommittee, and the Joint Legislative Budget Commission. Please note that one of Representative Hudson's major issues for this session is to address government duplication and waste. He has introduced a number of nursing home and assisted living facility bills that aim to reduce or eliminate regulatory reduction. And so with no further ado, here are a few words to you from Representative Matt Hudson.
Well, House Bill 119, it's a big bill. It's about 140 pages, plus or minus a little bit, and it's a fairly significant attempt to get ACA out of the way of healthcare providers. It looks to streamline and work to create more efficiencies within 29 different licensed provider types. It's a very large bill that I actually passed last year. I had some provisions in it last year that the former governor was not particularly keen on, and so he vetoed it. I refiled the bill this year with removing those provisions because we were going to handle those in another vehicle this year and in a different bill, and then added in some things that we had done some research on that we thought would give additional relief to providers and to, quite frankly, to patients as well. I'm a firm believer that if you get government out of the way of business, business knows how to create jobs. And if we don't have healthcare providers filling out duplicative reports, things that mean absolutely nothing to anybody, then you know what? They're going to have more time to give good quality patient care and, in turn, great jobs. I think one of the key elements in the bill for assisted living facilities and nursing is, you know, as a former caregiver of an Alzheimer's patient myself, I understand the importance of respite. And I understand that there are times when you just need a break. And that doesn't always fit neatly in a nice little package. It's not something that you can always schedule. It's not something that just works out swimmingly, that you're going to have somebody on call to give you a hand. And so creating an opportunity for our nursing homes and assisted living facilities to be able to use their existing capacity to be able to provide respite opportunities so that family members can just have a little bit of break and have a little bit of life, I think is very important to the quality of life of the caregiver, and that person in turn will have a better opportunity to give care to their loved one. And so I think this is a really good, important component of this bill. Well, I will say this, you know, I've been very fortunate to serve. This will be my 4th session, and there are some groups that are very engaged in this process, and FASA is one of them. You have a great team up here that is passionate about representing you and bring to light the issues that are important to their members. And they do so in a way that is considerate of other groups as well, because it is a process, and we always have to do that. I think this session creates a lot of opportunities for us to change the way we view government and to change the way that people view government. And hopefully, with a lot of hard work, some good partners like FASA, we'll be able to come to the end of session here in about 50 days with a good resolution that will work well for the citizens of Florida.
Hi, I'm Tom Randall, Vice President for Public Policy and Governmental Affairs for FASA, and I just want to take a minute just to say, please, if you can, attend our legislative and regulatory workshop, which will be held in Tallahassee on March 29th and 30th. This is a pivotal time, a crucial time for the legislators to hear from our association and our members. They'll be making major decisions on Medicaid reform, on the budget, and other items that are important to our association. So I encourage you to please attend our legislative and regulatory workshop on March 29th and 30th. And if you have any questions, please feel free to contact me or any member of our public policy team.